Although the novel severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2 primarily infects cells lining the respiratory tract, it has been reported to often infect tissues in the cardiovascular system as well. For instance, it can damage the vascular endothelium, which results in cardiovascular comorbidity and increases the risk of mortality. However, whether it also affects the vascular elasticity, a marker of structural robustness, remains less understood. Stiffness of arterial walls can easily be determined by measuring pulse wave velocity, or PWV. A group of researchers from and around the Medical University of Vienna in Austria thus used PWV to fill this gap in knowledge. In their study, they compared 22 acutely ill COVID-19 patients with 22 age and sex-matched acutely ill patients without COVID-19. They measured PWV in patients with cardiorespiratory symptoms like dyspnea or chest pain using an oscillometric pulse wave device. They then calculated brachial ankle PWV and carotid femoral PWV based on PWV and patient height. In patients with COVID-19, both the brachial ankle PWV and carotid femoral PWV were higher than those in patients without COVID-19, and COVID-19 was independently associated with higher PWV in the regression analysis. Moreover, in the 50% of COVID-19 patients who eventually succumbed, PWV values were higher than the values in those who survived. In survivors, PWV directly correlated with the length of hospital stay. Overall, the findings suggest that arterial stiffness, reflected by PWV, is increased in acute COVID-19, and that higher values are associated with an increased risk of mortality and longer hospital stays. Therefore, PWV measurement can be a non-invasive, quick, and cost-efficient method to identify COVID-19 patients at risk of clinical deterioration in diverse clinical settings.